In this video, I am going to discuss some of the moral issues related to active euthanasia and physician-assisted suicide in biomedical ethics. Many of us have been in the difficult and heart-wrenching position where we have to decide what is best for our pets, in cases where our pets are suffering from a terminal illness or are experiencing tremendous pain and suffering. Oftentimes in these situations, active euthanasia is the most humane option. It does seem rather cruel to allow our pets to continue to suffer, especially when we are in a position to intervene on their behalf and alleviate their suffering. However, if active euthanization is sometimes the most humane choice for our pets, why can't this be the case for our fellow human beings? We do not humanely euthanize our pets because we believe their lives somehow matter less than ours. Quite the opposite. It is out of care, consideration, and concern for our pets' welfare that we elect to end their lives through active euthanasia. One philosopher that wrote extensively on these issues was James Rachels. According to Rachels, if passive euthanasia is morally permissible, then so is active euthanasia. In cases of terminal illness, passive euthanasia occurs when a physician does not intervene to prolong the patient's life or avoid their patient's death. So, everything from removing a patient from a respirator, to removing a feeding tube or hydration, or withdrawing from any kind of medical treatment counts as passive euthanasia. In cases of terminal illness, hospice care and other forms of palliative care also count as passive euthanasia, but we typically think that all of these things are morally justified. Passive euthanasia is primarily justified by the right of the patient to withdraw from or refuse medical treatment. This is an aspect of patient autonomy and self-determination. However, passive euthanasia can also be supported by the right of the physician to determine that further interventions would be medically futile. In cases of medical futility, further medical intervention will either not reverse the patient's condition or significantly improve their condition. Passive euthanasia is most often authorized by a patient through an advance directive. This is when a patient directly states in writing what their medical preferences are in certain circumstances. However, a patient can also directly consent to passive euthanasia if they are competent to make their own medical decisions. If a patient has no advance directive or is not medically competent, then the physician will consult with the patient's next of kin to make a determination about which options are best. Individuals that support passive euthanasia but are opposed to active euthanasia usually claim that there are relevant moral differences between the two. One of the most common alleged differences is that passive euthanasia involves letting the patient die, while active euthanasia involves directly killing the patient. If we believe that direct killing is morally worse than letting die, then passive euthanasia is morally permissible, but active euthanasia may not be. A slightly different variation of this is that in passive euthanasia, the physician does nothing to bring about the death of the patient, while with active euthanasia, a physician does do something to bring about the death of their patient. Thirdly, others claim that active euthanasia conflicts with the physician's obligations or with the aims of medicine in general. Let's first discuss whether or not killing is really morally worse than letting die. Here is an example from the movie Batman Begins. Christian Bale and Liam Neeson are fighting each other on a runaway train that is about to crash. Christian Bale then looks at Liam Neeson and says, "I won't kill you, but I don't have to save you." Sorry. In this circumstance, Christian Bale's failure to save Liam Neeson guarantees Liam Neeson's death. And it is also the case that Christian Bale directly intends Liam Neeson's death. That is precisely why he is refusing to save Liam Neeson. In this circumstance, is there really a moral difference between directly killing Liam Neeson and just refusing to save him in order to bring about his death? Can we actually say that if Christian Bale would have just stabbed Liam Neeson, that he would have been doing something worse than just failing to save him while directly intending his death by failing to save him? How is this relevant to the distinction between passive and active euthanasia? Well, in passive euthanasia, the patient's death is directly intended by withdrawing medical care. The hope in withdrawing medical care is to quicken the patient's death in order to alleviate their suffering. In that respect, it is also not true that in cases of passive euthanasia, the physician does nothing to bring about the patient's death. The physician decides to withdraw medical treatment, which is doing something to bring about the patient's death. The physician decides to withdraw medical treatment in order to quicken the patient's death and thereby alleviate their suffering through their death. Furthermore, it is also true that there seem to be relevant cases where letting die is actually morally worse than direct killing. The case involving the humane euthanization of a beloved pet shows this. If it is true that being in pain and experiencing suffering are intrinsically bad states of affairs, then in the absence of some overriding good, we have an obligation to alleviate pain and suffering. But if a patient is terminally ill, there is no overriding good involved in extending their life. So, in making determinations about the moral permissibility of active euthanasia, we must consider not only the quantity of life, but also the quality of life. With respect to active euthanasia conflicting with physicians' obligations and the aims of medicine, it is claimed that the physician's primary obligation is to promote their patient's health and not to harm them. But since active euthanasia either fails to promote the patient's health or itself causes harm, then active euthanasia is not morally permissible. However, what this argument fails to overlook is the fact that an essential component of promoting health and not causing harm is to alleviate a patient's pain and suffering. Practically speaking, sometimes active euthanasia is the best means available to accomplish this. But if that is the case, active euthanasia is compatible with both physicians' obligations and the aims of medicine. Given those considerations, we can outline Rachel's argument as follows. Premise 1. An act is wrong just in case it either harms someone or violates someone's rights. Premise 2. Sometimes active euthanasia does not harm anyone and does not violate anyone's rights. 3. Therefore, sometimes active euthanasia is not wrong. So what support can be given for the premises? What is needed to justify premise 1 is some relevant account of what it means to harm someone. So, here is a common way of defining harm. To harm someone is to make them worse off than they otherwise would have been. But in cases of terminal illness, active euthanasia does not make the patient worse off than they otherwise would have been. Their death is inevitable. But if that is the case, it follows that in cases of terminal illness, active euthanasia does not cause harm. But if active euthanasia does not cause harm, then active euthanasia cannot be wrong to the extent that it causes harm. Now, it should be noted here that active euthanasia not being harmful is a necessary condition for its moral permissibility and is not a sufficient condition for its moral permissibility. Even if a patient is terminally ill and would benefit from active euthanasia, it would still be morally wrong to euthanize them against their will. If a patient would not have given their consent to active euthanasia, then to euthanize them would be a violation of their rights. That is why James Rachels also maintains that active euthanasia must not violate anyone's rights in order to be morally permissible. One philosopher who was vehemently opposed to active euthanasia was bioethicist Daniel Callahan. According to Callahan, it is a mistake to maintain in medicine that there is no distinction between killing and letting die. Callahan thinks that this distinction is essential in medicine. Why? Because failure to maintain this distinction means that physicians are always morally responsible for the deaths of their patients, or always bear the moral burden of the death of their patients, regardless of how those deaths occurred. Callahan also thought that even if the patient's right to self-determination may give the patient the right to commit suicide or die a dignified death, it doesn't follow from that alone that patients have a right to active euthanasia or physician-assisted suicide. Active euthanasia and physician-assisted suicide both involve the assistance of the physician in aiding the patient in their death. Now, here Callahan uses the language of the physician treating their patient's values rather than the patient's medical condition. When a patient argues that a doctor must assist them with their death, the patient is deciding to end their life due to thinking that their life is not worth living. But in arguing that the physician has an obligation to aid them in their death, the patient is essentially arguing that the physician must agree with them that their life is not worth living. Callahan argues that whether or not patients' lives are worth living is not for the physician to decide, and hence physicians may not aid their patients in either securing a dignified death or promoting their suicide. More generally, we can ask whether the right to a dignified death is a negative right or a positive right. Negative rights are based on non-interference. If you have a negative right to something, that only means that I am not permitted to thwart or interfere with your attempts to secure whatever it is for yourself. A positive right, on the other hand, is something that I am obligated to actively promote on your behalf. So if a right to a dignified death is a negative right, then that only means that other parties cannot prevent us from securing a dignified death for ourselves. As Callahan says, you may commit suicide. However, if the right to a dignified death is a positive right, then that means we have a legitimate claim on others to aid us in securing a dignified death for ourselves. But if it does turn out that the right to a dignified death is only a negative right, then the right to a dignified death does not amount to a right to either active euthanasia or physician-assisted suicide. However, as we have already seen, the right to not experience needless pain and suffering does seem to be a positive right. We do have an obligation to alleviate the pain and suffering of others when we can. Now, if there are times when active euthanasia or physician-assisted suicide are the best means available for doing so, then we may have a positive right to either active euthanasia or physician-assisted suicide after all.